1-year-old child with anterior polar cataract, and this is the stage of visco filling of the anterior chamber, side ports, anterior capsular axis through the 2.2 millimeter incision after staining of the anterior capsule. All of the time, pull the edge of the rhexis to the center in a centripedal fashion. All of the time, be away from the edge of the anterior pole, ending the rhexis by pulling the capsule to the center. Mild hydrodissection. There is no posterior polar cataract, no risk of open posterior capsule. Irrigation aspiration is done from the periphery to the center using 2 separate needles. The anterior polar cataract had been removed by forceps, then continuing the irrigation aspiration, taking care not to go to the center for fear of having open posterior capsule. After finishing the irrigation and aspiration, filling the bag with viscoelastic posterior capsular axis, starting with finding an edge, an elliptical edge, which helps to create the posterior capsular axis, injecting viscoelastic behind the posterior capsular opening, continuing the posterior capsular axis being smaller than the anterior capsular axis. The size of the anterior capsular axis is about 5.5 millimeter, while the size of the posterior axis is about 5 millimeter. Vitrectomy to remove the anterior vitreous face, and before doing the vitrectomy, viscoelastic is injected behind the posterior capsule. After finishing the vitrectomy, widening the port, the main port, and putting 3 pieces IOL in the bag, taking care that the trailing haptic to be between the anterior capsule and the posterior capsule, taking care that the optic opens slowly, the leading haptic is away from the wound, then putting the haptic in the bag between the anterior capsule and posterior capsule, and at the end doing capsular optic capture to the optic of the intraocular lens. Suturing the wound is mandatory for small children for fear of iris incarceration in the wound or rubbing the eye. 2 sutures had been taken in the main wound, 1 suture in the side port, each side port. This decreases the chance of developing glaucoma after the surgery, keeping the iris away from the wound, keeping the cornea all of the time tightly closed. Thank you very much.